An eating disorder test is a tool healthcare professionals use to assess and diagnose eating disorders. Eating disorders are mental health conditions that impact an individual's relationship with food and body image. They can include conditions such as anorexia, bulimia, binge eating disorder, and other specified feeding or eating disorders. Eating disorder screening tests can take various forms, including self-assessments, clinical interviews, and standardized psychological assessments. Self-assessments are questionnaires individuals can complete independently, providing a preliminary understanding of their symptoms and eating behaviors. Clinical interviews by healthcare professionals offer a more in-depth evaluation through questions about the individual's eating habits and related behaviors. Trained professionals administer standardized psychological assessments based on criteria for diagnosing eating disorders. Healthcare professionals need access to various eating disorder tests to ensure accurate and efficient patient assessment. It is appropriate to use this resource in the following situations: during routine physical exams, after significant weight loss, after changes in eating habits, after expressing concerns about body image or weight, and after seeking help for mental health concerns. Our printable eating disorder screening test is a resource for healthcare professionals working with patients struggling with an eating disorder. This includes primary care physicians, mental health professionals, pediatricians, nutritionists, and other healthcare practitioners. To use our eating disorder test, follow these steps. Download the eating disorder test off our Carepatron platform, which you can find in the description. The eating disorder screening test is a self-assessment tool designed to help identify potential symptoms of an eating disorder. It is important to note that this test is not a diagnostic tool and should not be used as a substitute for a professional evaluation by a healthcare professional. Firstly, before starting the test, it is essential to gather patient information including their name, date of birth, and contact information. Next, answer the questions responding with the answer that the patient thinks best reflects them. There are 25 questions about food, weight, and body shape related thoughts, behaviors, and attitudes. The question uses a 5-point scale ranging from almost never to almost always and asks about topics such as binge eating, purging, excessive exercise, and dietary restrictions. Once the patient has completed the test, it is crucial to evaluate the results and determine if they may be experiencing symptoms of an eating disorder. The results should be discussed with a healthcare professional to understand the patient's relationship with food better and determine the best course of action. Professional evaluation by a trained healthcare professional, such as a doctor or therapist, is necessary to diagnose and treat an eating disorder. Here is a sample of our eating disorder test from our Carepatron platform. To find our eating disorder test, go to our Carepatron platform or click on the link in the description. In our template section, we have a variety of templates and worksheets for you to use with your patients. You can filter or type in the keywords to find the worksheet. Thank you for watching our video at Carepatron. If you enjoyed this video, give us a like. If you would like to see more videos like these, subscribe to our Carepatron channel or click on one of our recommended videos.